How to use health insurance enrollment helpfully. Properly. Beginner mistakes that cost you. Health insurance enrollment help platforms are convenient, but beginners often make mistakes that lead to coverage gaps or higher premiums. Most people get this wrong by rushing through the process. The first mistake is not understanding your coverage needs. Assess your medical history, prescription requirements, and preferred providers. Without this, you might choose a plan that leaves you exposed. Another common error is ignoring deductibles and out-of-pocket maximums. Low premiums can be tempting, but high deductibles can make healthcare unaffordable in emergencies. Compare total potential costs, not just monthly payments. Many users skip subsidy eligibility checks. Government programs can reduce premiums or out-of-pocket costs. Not applying for these savings results in overpaying unnecessarily. A surprising mistake is neglecting enrollment deadlines. Missing open enrollment or special enrollment periods can leave you uninsured for months. Set reminders and verify deadlines carefully. Finally, beginners fail to double-check provider networks. Choosing a plan outside your preferred doctors or hospitals can lead to denied claims or surprise expenses. Confirm network availability before enrolling. To properly use health insurance enrollment help, assess your coverage needs, compare total costs, check subsidies, meet deadlines, and verify networks. Following these steps ensures you get the right plan at the best possible cost.